morning, my name is Isabel Barajas, and thank you for tuning in to the CSUB Nursing Student Psych Talk Show. Today we will be talking about schizophrenia. Schizophrenia is a mental health disorder that affects an individual's social and occupational life due to an impaired thought process and perception. This condition is characterized by delusions, hallucinations, disorganization, cognitive dysfunction, and impairment in reality testing. With schizophrenia, there are periods of remission and exacerbation. Individuals with schizophrenia follow a pattern of 4 phases: the premorbid phase, the prodromal phase, the active phase, which is also known as the schizophrenia phase, and the residual phase. During the premorbid phase, the individual is noted to have social maladjustment, be socially withdrawn, irritable, and have antagonistic thoughts and behavior. In the prodromal phase, the individual experiences a significant functional impairment and nonspecific symptoms, such as sleep disturbances, anxiety, irritability, depressed mood, poor concentration, fatigue, and behavior deficits such as deterioration in role functioning and socially withdrawn. This phase lasts about 2 to 5 years. The diagnosis for schizophrenia is made in the active phase, where the psychotic symptoms are prominent. For schizophrenia to be diagnosed, the individual must be in the active phase for at least 1 month. For the patient to be diagnosed, they must have 2 or more of the following symptoms: delusions, hallucinations, disorganized speech, grossly inorganized, catatonic behavior, and symptoms of absent affect. Delusions and/or hallucinations must be present for a schizophrenia diagnosis to be made. The residual phase is the 4th phase and is also known as the remission phase. This follows the active phase of schizophrenia. The positive symptoms, which are delusions, paranoia, word salad, hallucinations, and delusions, become either absent or are no longer prominent, while the negative symptoms, such as inappropriate affect, emotional ambivalence, social isolation, and anhedonia, remain. The prevalence of schizophrenia in the general population is less than 1%. The male to female ratio of the incidence of schizophrenia is 1.4 to 1. Schizophrenia typically occurs before 30 years of age, but is most commonly seen to occur earlier in males than in females. Family history of schizophrenia increases the probability of the disease occurring. Viral infections of the central nervous system during childhood have also been found to link to adult-onset schizophrenia. Epidemiological statistics have found that lower socioeconomic classes experience schizophrenia more often. However, it is unknown if schizophrenia is due to lower socioeconomic class or if the symptoms attributed to schizophrenia cause a shift to the lower class due to an inability to hold an occupation. The exact etiology of schizophrenia is still unknown. It is thought to be a result of a combination of biological, psychological, and environmental factors. There are a few theories out there, such as the dopamine hypothesis. This is a theory that suggests schizophrenia is caused due to an excess of dopamine-dependent neuronal activity in the brain. This theory is supported by the use of antipsychotics in schizophrenia. The antipsychotics decrease the levels of dopamine available to the brain and thereby reduce the schizophrenic symptoms. However, antipsychotics do not help in all cases of schizophrenia. Recent research has found that glutamate can cause schizophrenic symptoms and therefore may be associated to the cause of schizophrenia. However, this has not yet been confirmed. In regards to treatment, it is medication and behavioral therapy, and we will be going into more detail about what medications and what behavioral therapies are typically used. I will now be passing it over to Sam, a psych nurse who will be interviewing a schizophrenic patient. Thank you.
Hello, my name is Samantha and I'll be your nurse today.
Hello, my child. I am Jesus Christ.
Oh, can I get your name and date of birth?
You should know that already.